Please introduce yourself.
Okay, so hi, my name is Vince. I'm a medical doctor by training. Then I absolutely nerdified myself because I didn't do any clinical work afterwards. I worked for quite a long time in stroke research and imaging, did a PhD in medical neuroscience, did during that time also a master in medical ethics, and 3 years ago I started coding myself and specialized actually on artificial intelligence. And I work at the Charité University Clinic in Berlin, where we develop systems to assist medical doctors to treat stroke better using artificial intelligence.
When you first started deciding to be a medical doctor, did you ever think you were going to end up as a programmer, as a coder, and getting involved in artificial intelligence? Did you think that was going to happen?
Absolutely not, and I blame my math teachers because I really had very bad math teachers, and at that time everything that was maybe somehow related to math, I thought that's awful. Now in the end, coding is just logic, and logic is really cool, and I would really suggest everyone not to be deterred by their math teachers and really think about picking up coding. It's a lot of fun. But absolutely no. I was pretty sure that when I started med school that I'm going to go into research and not into clinical work. I knew that, but that I would end up coding myself, no, absolutely not.
And so what next?
What next? Next is finishing these systems, maybe commercializing them and bringing them into the clinical setting to help stroke patients.
And what's the key thing which the system will do which currently isn't done?
So right now we work according to guidelines in the clinical setting for stroke. So that means every patient is treated the same way. The patient comes to the clinic, we look at the time, it's called the time clock paradigm. We look at the time. If a certain time hasn't passed yet, we can treat the patient, otherwise we can't. This is the one thing that we would like to change to make it more individualized. And secondly, there are great cases where physicians today don't exactly know if they should probably treat or not. Here our system will give another data point, a guidance, if the patient should be treated or not. AI will not replace medical doctors soon. It will definitely not do that. It will help them. So it's the combination of artificial and natural intelligence that we're aiming for.
And what do normal, not enlightened doctors think when you talk like this?
It's very different. It really depends on the doctor I talk to, and also the specialty, and also the clinic. There are progressive clinics, there are conservative clinics, there are progressive doctors, there are conservative doctors. There's one field which is radiology, which is very receptive to artificial intelligence because they have been working with technology combined with imaging for a long, long time. They are picking up artificial intelligence very quickly. Other fields like neurology, they're more conservative, so we have to convince people a bit more.
Brilliant, thank you.
Sure.